Hi, my name is Robert Kridel. I'm a Clinician Scientist at Princess Margaret Cancer Center, University Health Network. So I'm a lymphoma researcher. Lymphoma, which is the fourth or fifth most common cause of cancer that affects about 12,000 individuals in Canada per year. And lymphomas are really a cancer from the lymphatic system, whereby patients oftentimes present with enlarged lymph nodes, sometimes also involvement of the blood, and it is classified in a way as a blood cancer because ultimately it's derived from a type of blood cells called lymphocytes. Lymphoma is a very diverse group of diseases. The most common types that we study also the most common forms of lymphoma overall, and they are called diffuse large B-cell lymphoma as well as follicular lymphoma. These diseases are quite different. Diffuse large B-cell lymphoma, which is the most common form of lymphoma, is an aggressive form of lymphoma that requires upfront treatment, in which we cure the majority of patients, whereas in follicular lymphoma, that is a more slow-growing disease, in which many patients at the beginning at least do not require treatment, but is unfortunately still an incurable disease for many patients. We have been looking at patients with follicular lymphoma through large collaborations both within Canada and also outside Canada, in the US, in Europe, and in Australia. So we study lymphoma samples from patients in great detail to identify the genetic abnormalities and other alterations that we can find in these samples, and then try to identify patterns of the disease. We try to identify subgroups of patients who do better or not so well with certain therapies. Then we're able to profile a number of genes that are abnormal in these cells and could identify 5 different subtypes of the disease or groups of patients with some clinical implications, because one of the clusters, for example, those are patients who had less good response to chemotherapy, which makes us believe that these patients likely should be treated differently in the future. A study in which we focus on diffuse large B-cell lymphoma, we identified that by knocking out a very specific gene called GNAS, we cause inflammation in the cells that led to the cells stopping to grow. Currently, we have been working on these discoveries for many, many years. The follicular lymphoma effort really started in 2017, so those are the longest stories that we're cooking for quite a long time. Overall, I think our 3 papers represent small pieces of the gigantic puzzle that is lymphoma, and those are important stepping stones. I think we're moving towards really better identification of patients who benefit from a certain therapy, but also better definition of novel therapies.